While vaccine super sites are now up and running, there have been a lot of glitches and setbacks along the way. So where do things stand, and when do experts believe we will reach herd immunity? Dr. Testa is the Chief Medical Officer with Dignity Health Southern California. He joins us now live to answer some of these questions. Dr. Testa, it's always good to see you. I know you just talked about it. You've been giving out vaccines all week. Let's talk about some of the glitches and the delays that people are having when they're trying to make these appointments. And with the new super sites they're opening, and many people say they've had a smooth experience. So what's your take on how the administration is going with giving out these vaccines?
Well, in the county of Los Angeles, we've given 1.3 million vaccines over the last 2 months. And remember, we've been rolling this out in the middle of the pandemic when we've been seeing some of our highest numbers. So the people who've been doing the rollouts are the people who've also been managing COVID with a very complex vaccine, right? 2 doses needs to be kept at ultra cold temperatures. So this hasn't been an easy process. But I'll tell you that we're harmonizing the registration process across both the county and the state. And we're getting a lot more engagement from providers to help because we're getting a lot less COVID cases. So we have more bandwidth to manage it. So I think we're going to see things slowly get better and better and better. But I just don't want us to forget, we've already vaccinated 12% of the population of Los Angeles County, which I think is a huge step forward.
That is a huge step. So what do you think is the key to helping get vaccines access to underserved areas?
Yeah, so I think there's one main thing. I love the massive vaccine sites. I think it's really important to have the big drive-throughs that people can commute to. But we have to remember, to get to the underserved populations, we have to bring the vaccine to them. You're not going to go to a great big drive-through if you don't have a car, if you take the bus, right? So the places that have been the most successful have partnered with community partners like churches and community centers to really bring the vaccines to those communities. And I think after we really get established with these mass vaccine sites, that's going to be the next outreach we'll need to do.
Absolutely. I mean, I don't, my mother is disabled and is not internet savvy. There's no way she could figure out how to make an appointment for herself. If we didn't help her, she wouldn't be able to do it. So my heart goes out to people who they need that vaccine, yet they don't have access to it. It seems very cruel, this part of it. So I can't wait to hear when we can get it out to people who really do need us to go to their homes and their communities. Let's talk about herd immunity. Do you have any idea when you think we might be able to reach it?
I think we have some ballpark ideas if things continue on the trajectory that we're on right now. So herd immunity for COVID is speculated to require about 70 to 90% of the population to be immunized. Now, if you look at vaccine rates across the United States, we're seeing about 900,000 first doses being given a day. If we continue at this trajectory, we would hit about 70% of the U.S. population in September. But you have to remember, a good amount of the population has already had COVID. So there have been people who said we're going to reach herd immunity as early as April. I think that's a little bit too soon. I think if you were to split the difference, we'll probably be hitting herd immunity if things continue the way they are, probably sometime in December, June or July.
That would be wonderful. Just to say we're going to hit herd immunity within the next few months. There is that light at the end of the tunnel. And we know you are helping this fight so much. So thank you so much, Dr. Testa, for your time. We certainly appreciate you taking some time out to talk with us as well.
Thank you.